This is Celebration TV. Revealing Jesus, releasing this.
Knowing that premarital sex is a sin, then how would you know if your future spouse has erectile dysfunction? That is, how do you know he is impotent? And if you're newly wedded, then realize that your spouse is impotent. What should you do? I will be giving medical and godly answers to these intriguing questions. Join me and my co-host, Dr. Kate, live on Health Talks, Friday 16th August 2021, 2 p.m. GMT +1, only on Celebration TV. I remain your celebrity. Hello, welcome to Health Talks. I am Dr. Amy Momo, a medical doctor and your host today. Here with us today is our co-host, Dr. Keith Primer.
Good afternoon, Dr. Amy Momo. Thank you for having me again. Good afternoon, Celebration TV viewers. Welcome to Health Talk today.
Today we are going to have a controversial topic on impotence, also called erectile dysfunction. And so, first of all, I'm going to tell you or give you a definition of erectile dysfunction, also called impotence. Impotence is the inability to achieve or sustain erection sufficient enough for satisfactory sexual performance. And Leonardo da Vinci gave us a very easy way of defining this impotence. He says it's the inability of the penis to obey its owner at will. So that's erection. That is impotence. And you know, it's quite alarming, the issue of impotence amongst people worldwide, amongst men. It's quite alarming. It has increased.
Yeah, this topic is quite a sensitive one, and it's also a bit controversial.
Yeah.
And that's because many people would not even want to discuss it.
Exactly.
Based on our cultural and religious background. Many people, even with erectile dysfunction, they and also their partners too, the female partners, do not want to talk about it. It is quite a common condition that we see in the clinics. Yeah.
And the statistics worldwide show that 54% of men within the age limit 40 to 70 years suffer from erectile dysfunction. And in Nigeria, a research was made by Osedebe in 2003. Yes, and he noticed that erectile dysfunction was noticed amongst men who came to the primary healthcare center. 54% of such men had erectile dysfunction. So you can imagine the prevalence and the incidence of such.
Yeah, it's quite common. It's a burden that men would have to bear, especially as they age. Yeah. Once you are above 40, 1 in 2 men will come with incidences of erectile dysfunction. It is that common. Yeah.
And the causes, one might ask, okay, the causes, what's the cause and all? It's
Yeah.
very diverse. There's psychological cause, vascular causes, nervous causes, and others, anatomical causes. Psychological cause, a man can be so worried, so stressed, maybe job issues, opportunities, and all the stuff. The labor of life can stress him to the extent of having erectile dysfunction. Vascular causes are also there. When one have hypertension, diabetes, and any other sickness, even obesity can also cause it.
Yeah. There are a lot of them. But there's one interesting question from a concerned person on the screen. He says, my husband cannot perform sexually. I don't want to lose my marriage.
Oh.
Yeah. Now, one of the causes of marital strife and disharmony is failure in the bedrooms, actually. Yeah. So now this person is obviously a woman is worried. Now she wants us to keep her anonymous. Says we've been married for over 4 years. The first 2 years of our marriage was filled with love, romance and adventure until our third year when he lost his job and everything went sour. At first, he wasn't interested in any kind of romance or fun time as he was always in his thoughts. He would go out and get involved in laboring and menial jobs only to return stressed and exhausted. And when I tried to make us have some intimate time, that is, have sex as a couple, he would say he's either too tired to or not in the mood. Now he says he has realized that even though he wants to, he no longer experiences any erection. This has affected his ego and is gradually sliding into depression. What do I do? Now, I can relate what she is going through at the moment. Now, this is almost going to be a psychogenic cause of erectile dysfunction, and that's one of the common causes of erectile dysfunction that a couple has. This is a man who obviously had been very functional, then with the stress of life, the guy is now having some form of erectile dysfunction. For this couple, I think we'll come back to queries later. Now let's broadly look at the causes of erectile dysfunction.
Like this example that was given, this statement, this woman and the husband's issue is obviously, as you said, psychogenic.
Yeah.
Stress and all can cause this erectile dysfunction.
Yeah.
Also, hypertension can cause it too. If someone, for example, is stressed or maybe has some vascular issues, have hypertension or diabetes, it can trigger erectile dysfunction.
Yeah, those ones are organic causes of erectile dysfunction.
Yes.
Like you mentioned, hypertension, uncontrolled hypertension.
Yeah.
Uncontrolled diabetes too will do that. Then lifestyle in itself.
Smoking and drinking.
Smoking, yeah. Alcohol intake. Obesity in itself. Of course, people who are big sometimes usually have this low self-esteem already. And then, especially when their partners too aren't helping matters. Yeah, when they body shame them, it can tilt them towards having erectile dysfunction. And then drugs too. Yeah.
Many drugs, so
medication. For people, it's common when you put a patient on a drug that can cause erectile dysfunction, and then they come back into the clinic with side effects of that drug. It's usually funny, many of them will not tell you, except they come with their wives. It's after consultation, the wife will not tell them, Oga, you have not mentioned the other one, or the thing is not performing as usual again. Yeah. Antihypertensive drugs, commonly, Aldomet will do that. Yeah. Even
antipsychotic drugs.
Antipsychotic, yeah, risperidone. Yes, drugs for mental disorders too.
Even for the drugs for peptic ulcer disease now.
Yeah. Cimetidine too, yeah. They do that. Yeah. Then even for like our gym enthusiasts, people who gym, that take anabolic steroids and testosterone, they come down with erectile dysfunction as a side effect to the drugs that they use. Yeah.
But the quite I'll call it intriguing, or I'll call it relaxing thing is that when such drugs are being stopped, you
can get back your erection.
Exactly.
Yeah, that's the beautiful thing. If once the cause of erectile dysfunction is a reversible one, once you take them out, it can return back to normal. And also malnutrition too is a cause of erectile dysfunction. Zinc deficiency, selenium deficiency, yeah, all those ones too would cause it. And then people who have had surgeries, surgeries, maybe a prostate surgery.
Oh, of course.
Yeah, and then they end up damaging some nerves. Yeah, true. You know, erection in itself is caused by a wide range of factors, from vascular to hormonal. Yeah. And then if any of them is not in place, then the chances of coming down with a dysfunction is possible.
And also we'll talk about anatomical, because when we talked about reversible, remember they could be reversible and irreversible. And we have the anatomy issue, like when the child is born with hypospadia or micropenis, small penis, then also
like Peyronie's
Peyronie's
disease too.
ENQUIRY.
Those ones that have a band that will prevent these people from achieving erection. Yeah. Is also a cause of erectile dysfunction. Yeah. So there are now looking at these common factors that are organic in origin. Back to this woman's question.
Okay.
Now, she doesn't want to lose her marriage, obviously, and now she is worried. Basically, for a man to get an erection, there are so many factors, like we said, that should be in place. And also there are some stimuli too, tactile, olfactory, auditory. Now, what is he hearing from the wife?
The man has to be in the mood for him to have erection.
Yeah, he has to be in the mood, but the woman should help. That's why when you manage couple, if you manage couples for erectile dysfunction, you see that it is not primarily the problem of the man. Of course, he's the one that bears the problem, but the solution lies with him and the wife.
Yes.
So if the man, this guy obviously is stressed, there's poverty, there's no job, yeah, so he's psychologically down. Now he also needs the wife to put him in the mood by the things he hears, the things he sees, the things he perceives. If what he perceives doesn't smell nice, the appetite will just die.
And also, you know, he lost his job. Just imagine such man finally gets a good job, like, of course.
Yeah, if he gets a good job and finances improve, of course his stressors will reduce, and then he will be able to meet his target in the bedroom.
Yes, but prior to that time, even before he had gotten his job, maybe he hasn't had a job as at that time, a counselor can help. Okay, we have a call now. Okay, we'll soon have a call, but if you want to call us, the number is in the screen. And now we have a call, John from Abuja. Hello, John.
Hello, good afternoon.
Good afternoon.
Good afternoon.
Yeah, good afternoon. I'm enjoying your program.
Thank you.
Thank you.
Yes, I just have this contribution.
All right.
I was told that prolactin level also can cause it. I don't know, maybe the doctor can explain on that. High level of prolactin in the body.
Yeah. All right. Yeah. Thank you very much, Mr. John.
Okay.
Thank you for calling in. Yeah, we're going to talk about that one too. Now, another cause, the hormonal causes of erectile dysfunction. It says a high prolactin level, which is very correct. Now, some drugs would increase prolactin levels, why some people basically have a high prolactin level. Yeah, they may be having a prolactin secreting tumor from the brain that releases a lot of prolactin, and then it will cause erectile dysfunction. Also, also testosterone levels too. So that's why while evaluating a patient for erectile dysfunction, we usually do some hormonal tests, testosterone levels, prolactin levels, and then even thyroid stimulating hormone level, because hypothyroidism is also a cause of erectile dysfunction. Same thing with hyperthyroidism. Yeah. When your hormonal levels is imbalanced, people are going to come down with erectile dysfunction. Yeah, it is a cause of that too.
So please, if you want to give us a call, feel free to give us a call. This is Health Talk, and you can call us and express your view concerning this our topic, erectile dysfunction, and any other topic or any other worries. We are here to answer you. We are here to give you more view or much education on various topics, medical topics. Thank you.
All right. So for this woman who threw up this question, I think what they need to do is to seek for help.
Yes.
Yeah. They have to see both a psychologist and a urologist. Yeah. Why the psychologist is working on their mental state, the urologist will look at their medical history, do some investigations, some examinations, and then they'll come up with a solution for our concern.
And while we go on, we're going to throw more light on things. Viewers, while we go on, we're going to throw more light on investigations and other measures concerning this erectile dysfunction and how to handle this erectile dysfunction thing. Right now we have a call from David. This is David from River State. Hello David, this is Health Talk and welcome to Health Talk. Can we hear your question?
My problem is I have a diabetes.
Hello David,
so
sorry. Okay.
I say I have a diabetes.
Okay, you can.
And the thing within my erection, my thing is not performing very well. So what will I do?
Okay. Thank you, David, for calling in. Yeah, he says he's a known diabetic, and now he's having erectile dysfunction. Yeah, diabetes, like we mentioned, is a known cause of erectile dysfunction, especially when it is uncontrolled diabetes. However, unfortunately, once you have nerve damage from uncontrolled diabetes mellitus, it is usually difficult to reverse.
That's true. So the question we'll ask David is,
are you on
drugs? And
is it
your
compliant?
Diabetes, exactly. Is it being controlled?
Yeah.
Are you compliant with your medication? And if you're not compliant with your medication, please, David, you need to take your medication. You need to take your medication. And also, you will need to see a urologist. You need to go to the hospital. You need to see a urologist. And with these measures, with the urologist and also a psychologist, all these specialists will help you overcome this erectile dysfunction.
Yeah. So he needs to watch his blood sugar level.
Yes.
Once he's compliant on drugs, the further damage will be altered.
Exactly.
Yeah. But if you don't comply with medicines, more damage will be done, and it will be irreversible, unfortunately.
And also, I will have to chip this concerning this erectile dysfunction. You know, I would have to break this down for our viewers to understand this. There's something called stress, oxidative stress, and all this that can come in to cause all this harm and to destroy the vessels. Because normally there are vessels in the penis that helps that blood flows in, making this erection come into play. And so, such vessels can be destroyed. And in this situation of destruction of the vessel, erectile dysfunction comes into play. If men try to take food or fruits that act as antioxidants, it will help them. So, David, you have to take healthy food. What I mean healthy fruits, you know, diabetic, you can take something with so much sugar and all, but taking fruit, taking vegetables will help you overcome this. In addition to your urologist visit and also your psychologist visit.
All right.
So, thank you, viewers. Right now, we're going to take a break. When we come back, we'll give you more information and more in-depth information of erectile dysfunction. Thank you for staying tuned, and please stay tuned. Knowing that premarital sex is a sin, then how would you know if your future spouse has erectile dysfunction? That is, how do you know he is impotent? And if you're newly wedded, then realize that your spouse is impotent. What should you do? I will be giving medical and godly answers to these intriguing questions. Join me and my co-host, Dr. Heath, live on Health Talks, Friday, 16th August. Knowing that premarital sex is a sin, then how would you know if your future spouse has erectile dysfunction? That is, how do you know he is impotent? And if you're newly wedded, then realize that your spouse is impotent. What should you do? I will be giving medical and godly answers to these intriguing questions. Join me and my co-host, Dr. Heath, live on Health Talks, Friday, 16th August, 2021, 2 p.m. Knowing that premarital sex is a sin, then how would you know if your future spouse has erectile dysfunction? That is, how do you know he is impotent? And if you're newly wedded, then realize that your spouse is impotent. What should you do? I will be given medical and godly answers to these intriguing questions. Join me and my co-host, Dr. Kate, live on Health Talks, Friday 16th. Knowing that premarital sex is a sin, then how would you know if your future spouse has erectile dysfunction? That is, how do you know he is impotent? And if you're newly wedded, then realize that your spouse is impotent. What should you do? Welcome back to Health Talks, and we're talking about erectile dysfunction. Please, if you have any question on this erectile dysfunction or you have similar stories, feel free to talk to us, call us, and share your view. We are here to listen to you, and we're here to give you, as I said, in-depth on this topic. The number is on your screen. Feel free to call this number. Let's communicate, let's share our views, and let's see a brighter way or ahead of this erectile dysfunction. Thank you.
All right, thank you, Dr. Amy. Back to possible solutions for this concerned person. Now, there are a lot of people who are going through similar situation now. There's a call?
Sorry, there's a call. John from Edo State. Hello, John. This is Health Talk. Can you feel free to tell us your questions or your contributions? Also, your experience.
My question is, I'm having a quick ejaculation.
Hello. Can you hear me?
I think we lost that.
Oh, sorry, we lost John's call. And we hope he's going to call back.
I didn't get that. Okay, fine. Now, there are a lot of couples going through similar challenges that they would not even discuss about.
And you know, some ladies have actually left their husband because of this, not knowing that there's a way forward.
Yes, people have left. A few days ago, during the last session of Wonders Without Number, Papa gave a prophetic word like that. That I was seeing a couple, the woman had already packed her bags and she was leaving because the man had erectile dysfunction. It's common, but many of them will not even tell you why they are leaving the marriages. They will bring up flimsy excuses. But the major crux of the matter is that the man is having erectile dysfunction. And many of these things are actually treatable.
Yes.
Especially if the cause is known. Yeah. If it's a psychogenic one, for example, it's to just work on the stressors. Sexual counseling is all that they need. Yeah. If it's an organic disease, for example, it's to treat the underlying condition.
And if it's medication caused,
if it's drug, just remove the drug that's causing it.
You know, information is power.
Yeah.
So that's why we're here to give our viewers concerning, as in give them information in all this way.
Yeah.
And it's, you know, I have to tell you this. It was a pathetic story, so saddening, sincerely speaking. The couple, the man had erectile dysfunction, and he couldn't let out, tell it out, and the woman was secretly mocking him. He committed suicide, for real. He committed suicide.
He couldn't handle. Yeah. You know, the people have different baseline mechanisms for handling stress. Some people usually cannot handle strenuous issues. But I think that one went too far.
Yeah, it did, but it was unfortunate. It was
even if it was a hormonal problem, for example, maybe he has had erectile dysfunction from adolescent age,
which was not
in this case, because they were married and they were happy initially.
They had like 7 children. They had 7
But
children.
I don't think it was worth it. He should just have sought medical care.
Yes, that's why, you know, our topic is very interesting,
Yeah.
and I'm sure that viewers have so much to contribute and all, and I know that we might be saving 1 or 2 couples, even more couples,
Yeah,
that
sure.
in the issue, or they are at the brink of having 1 or 2 issues concerning this area.
So you can call in numbers displayed on the screen 0704-607-6612. Call in, give us your contributions, ask questions as much as you want us to attend to you, whether on this topic or a topic outside erectile dysfunction. Now, Dr. Emi, there's
Yes.
also a scenario
Okay.
I've seen. A couple got married.
Okay.
Of course, we preach abstinence.
Yeah.
Yeah, and then they abstained, they got married, only for the sister to find out that Oga was impotent. Yeah. What do you think?
Wow. So normally, the immediate effect would be, or the immediate response would be, oh boy, jackpot will
I'm leaving the marriage.
leave.
Yeah, because you know that's
not
because.
supposed to, that shouldn't be the immediate action.
But I don't think they discussed about it before they entered into marriage. You know, because of our background,
Yeah.
people would not usually discuss these things.
True.
And I think it is important that people talk about them. The lady did not even ask. Of course, he just believed
Okay.
that the guy was potent, only for her to get into the marriage. And
see
she
that.
started coming down with complaints that Oga was always going out every night
Oh.
when they wanted to consummate their marriage.
Oh.
And then the day she now caught him red-handed, he couldn't escape. He found out that this guy wasn't. So is there a possible way that she would have known whether the guy was potent or
Sure.
not?
You and I know there are possible ways, and very soon our viewers will know about it, and they will inform themselves about all this.
Okay.
Yes, very soon.
All right, there's a call coming in from Matthew from Rivers State. Thank you for joining us. Welcome to Celebration TV Talk.
All right.
Can we have your contributions?
All right. Thank you very much. Yes.
We can hear you.
All right. Good afternoon.
Good afternoon. Welcome.
All right. Please, I actually want to ask a question. I heard you talk about T-Rex as one of the cases of. All right. I heard you talk about T-Rex as one of the causes of erectile dysfunction. Please, can you be, specific? What kind of T-Rex are we talking about? We have different types of T-Rex. We have physical stress, mental stress, emotional stress. So, what particular stress can a man avoid that could lead to this kind of? I don't know. Can you just expatiate on that?
Okay. Thank you very much. Thank you. Now, Matthew says he heard us mention stress as a cause of erectile dysfunction. Now, he wants to know what type of stress are we talking about.
Well, that's interesting. Thank you, Matthew, for the question.
Yeah.
There are various types of stress. It could be, when we mean stress, psychological stress can cause it most time. Yeah, though we're talking about psychological, but of course, all sorts of stress also always lead to one issue, oxidative stress. Whatever, no matter the stress you face, whether it's through work or your fatigue and everything, it affects your body, affects your cell, thereafter what? Causing erectile, it might cause erectile dysfunction.
A man who cannot provide for his wife and comes home and the woman is troubling him, that's stress on its own.
Exactly.
Yeah. So it could be mental
stress.
Yeah. It could be from your job. It could be from the home front.
Even for the woman herself.
Yes. When you marry a troublesome person and there's no peace at home, all this tells on one's psychology.
Yes, the Bible says it's better for a man to stay
to go and stay in a cave on the rooftop than to get married to a nagging woman. So yeah, any stress at all from issues of
Issues
life.
of life, psychological, physical,
Financial.
mental, financial stress, and all such.
All of them
Yes.
will play a role in causing erectile
erectile
dysfunction. Yeah.
Very well. Very well.
So now, back to that particular lady. What do you think she should have done before she got married?
Okay. First, she would have done some tests, like tests. Of course, most time, ladies, they do tests. They do their scan, pregnancy tests, and all. The man would have actually gone to do some tests too.
You know, this is quite
check.
controversial. There's, a religious body actually tried this at a point where they subjected the man to do some investigation to determine whether they were first potent and whether they were fertile.
Okay.
But it didn't sail through because many people felt psychologically traumatized.
I understand.
Now, you are telling a young man who feels or who knows that is potent, you are subjecting them to do medical examinations. But basically, there are some investigations and even physical attributes that an individual will see.
Exactly.
And you may be able to tell
Yes,
whether this one is potent or not.
Like a male having a breast.
Yeah, if you see a male who has a female type of breast or a female
voice.
type of narrow voice. So they could just be pointers.
He's a pointer.
Yeah, but it's not it's not a hard or fast
like
rule. Yeah.
Exactly.
Now those ones are there, and then the people should be subjected to physical examination.
Physical examination and also history.
Yeah, history,
Yes.
and then also examinations too,
Because some
and
questions.
investigations.
Yes. Like questions that should be asked is has he ever done a surgery before when he was young?
Okay.
That's important.
Yeah.
Have you ever done a surgery?
Any surgery in the groin region?
God
or-
bless you. In the groin region, perineal surgery.
Yeah.
And also,
Hello?
okay, so there's
Hello?
a call now. This is Chris calling from
Hello?
Edo State. Hi, Chris.
Yeah.
You can take the talk.
Hello?
Good afternoon, Chris. Welcome.
Good afternoon.
Doctor, we can hear you.
Yes. I'm calling from Edo State.
All right.
I heard somehow the guy that called before, John from Edo State, one of the questions what he was trying to ask, and that's my area too. Quick ejaculation. Having quick, somebody having quick ejaculation. What do you do about it?
Okay.
You don't laugh. You understand? Somebody don't
I
laugh.
do.
Okay. So what's the thing? And maybe you are still experiencing some infection in your private part and stuff like that.
Okay.
Thank you.
Yeah, thank you, Chris. Okay, I think that was a question that we missed from a caller earlier. He says, what would you do if you experience premature ejaculation?
Okay.
Yeah.
Okay.
That is concern too.
Actually, erectile dysfunction, okay, impotence,
Yeah.
and
No, this guy,
premature ejaculation.
this guy has a potent penis per se, but he ejaculates.
Yeah.
He feels he ejaculates too quickly. What should he do?
Okay, I'm trying to, we have to tell them that the difference between premature ejaculation and impotence.
Sure.
Yes.
Sure.
Because impotence is when the penis cannot achieve, it cannot stand.
Yeah.
Let me use the language.
Mhm.
Then premature ejaculation now is the penis can stand quite well, but the ejaculation is quite fast. Before he even reaches anywhere, it's like that's it's.
Okay. Now, premature ejaculation is also a very broad,
It's a very broad one.
controversial one.
Yeah.
But there are a lot of things that can be done. Now, if you engage in a whole lot of foreplay, the sexual act actually is not for you alone. It's also for the satisfaction of the partner. So what you should do is to engage in a lot of foreplay.
Of course. It has to.
And having stimulated her enough, and she has had some form of satisfaction in quote.
And also, you know, fear, nervousness could come in. For example, yes. For example, a married couple just come in and this is the first time, and he's nervous, she's nervous, and he could just have this premature ejaculation.
Yeah.
He could just have it.
But for this this caller, I think it is a consistent thing that is having.
I had a patient like that who came to my consulting room and he was nervous, and I was like, anything like yes, you know the function, like what is MI is still not the function. Okay, calm down. And then he explained to me what happened, that he has been okay since thereafter he noticed that he was having this premature ejaculation. What should we do? So I had to counsel him and I had to tell him about other medication, because you're aware that there are some medications that can be used for that.
It can use drugs.
Yes, but before we talk about the medication, we have to think of the causative factor. The causative factor is very important. Thereafter, we know actually what to do concerning it. So my advice to him is that first of all, he has to calm down. If this is just a new marriage, he has to calm down, and also if it's persistent, or he has to see a doctor. Yes.
Yeah, sure. He has to see a doctor. But like we said, engaging in a lot of foreplay will help. Some diet too will help. It needs a whole lot of antioxidants, zinc, selenium, and other vitamins too. They will help. And then drugs also can help. And then it also needs the spousal support. Yeah, because once the woman is already nagging, your chances of recovering become slimmer.
In fact, that nagging itself can even cause the...
Yeah, it can. The anxiety state would even make conditions worse. So the woman has to be understanding enough. They have to talk about it and then see a doctor too. That one will help. And he also mentioned, say somebody has been infections. Well, I wasn't too clear on the type of infection he was talking about though. Yeah. But if it's anything infection, I think you should see a doctor.
You should see a doctor, because such can actually cause it. Yes, it's true. Sexually transmitted infection can actually cause...
they can, over time.
Over time, not immediately.
Cause those stuff. I think it needs medical attention too. Okay. And then back to that, the lady, yeah.
Yes.
So the things that they would have done is, on a physical examination of the young man, when they notice things like tiny voice, breast development, you know, there's a male pattern of egg growth, basically. Yeah, the broad one. Once they start having the triangular shaped pubic egg growth, could be an indication of hypogonadism.
Yeah. That's true. Yeah. And for me, you know, the issue is, why did this young man, not tell the woman before getting married to her? And some people, they could get worried concerning this.
Yeah, that's another controversial one. Did the woman ask? Would you blame the man for not? Should I walk up to a woman I intend getting married to and say, I'm not potent? It doesn't go well. But that's why I feel the woman should have asked some questions. But our background will not allow us to ask salient questions like that. Yeah. Okay.
So, I was saying concerning these issues, the woman, as you said, the man should have opened up to her, and that is very, very funny, as you said. But he should have. But a man can actually open up to a woman, or he can actually test himself to know what to do at a particular time. But we're going to answer such questions. We're going to throw more light on this, on what to do, the investigation to do, also the drug to do. And if you have other questions, as I said, feel free to tell us. Feel free to communicate with us. Thank you. For now, we are going to take a little break. When we come back, we'll give you more loads of information, more loads of discussion about this. Stay tuned. Knowing that premarital sex is a sin, then how would you know if your future spouse has erectile dysfunction? That is, how do you know he is impotent? And if you're newly wedded, then realize that your spouse is impotent. What should you do? I will be giving medical, and godly answers to these intriguing questions. Join me and my co-host, Dr. Kate, live on Health Talks, Fridays.
Hello, have you been searching for an appropriate platform to advertise and promote your product and services? Are you a minister of the gospel and you want your message to spread across the globe? Stop this search. We've got the coverage to give your voice and ministry the amplification you require. To get a rewarding and cost-effective solution to that business idea of yours, Celebration TV is here to take your dream to the climax. We provide the following services: voiceover production, documentary packages, video production of your event, video editing, script writing, affordable live broadcast of your events, and more. For more information, please contact us on +234 703 341 3637 or +234 816 234 8181. You can also reach us via our social media platform: Facebook Celebration TV, Instagram My Celebration TV, Twitter us at My Celebration TV, YouTube Celebration TV. And you can send us a mail at celebrationtelevision@gmail.com. Hello, have you been searching for an appropriate platform to advertise and promote your product and services? Are you a minister of the gospel and you want your message to spread across the globe? Stop this search. We've got the coverage to give your voice and ministry the amplification you require. To get a rewarding and cost-effective solution to that business idea of yours, Celebration TV is here to take your dream to the climax. We provide the following services: voiceover production, documentary packages, video production of your event, video editing, script writing, affordable live broadcast of your events, and more. For more information, please contact us on +234 703 341 3637 or +234 816 234 8181. You can also reach us via our social media platform: Facebook Celebration TV, Instagram My Celebration TV, Twitter us at My Celebration TV, YouTube Celebration TV. And you can send us a mail at celebrationtelevision@gmail.com. Hello, have you been searching for an appropriate platform to advertise and promote your product and services? Are you a minister of the gospel and you want your message to spread across the globe? Stop this search. We've got the coverage to give your voice and ministry the amplification you require. To get a rewarding and cost-effective solution to that business idea of yours, Celebration TV is here to take your dream to the climax. We provide the following services: voiceover production, documentary packages, video production of your event, video editing, script writing, affordable live broadcast of your events, and more. For more information, please contact us on +234 703 341 3637 or +234 816 234 8181. You can also reach us via our social media platform: Facebook Celebration TV, Instagram My Celebration TV, Twitter us at My Celebration TV, YouTube Celebration TV. And you can send us a mail at celebrationtelevision@gmail.com. Hello, have you been searching for an appropriate platform to advertise and promote your product and services? Are you a minister of the gospel and you want your message to spread across the globe? Stop this search. We've got the coverage to give your voice and ministry the
Okay, welcome back. Thank you for staying tuned to Celebration TV on Health Talk today. We'll be discussing erectile dysfunction. Now, we'll quickly look at possible solutions to erectile dysfunction. Yeah, and some of these conditions, like we mentioned, that are reversible. The solution to them is tackling what is causing it. So for a couple that has erectile dysfunction, first thing that they must do, they must be sincere to themselves.
Sure.
They must be willing to seek for solutions. Yeah, and they must be willing to go to seek for solutions together.
Yes, in the right place.
Yeah, in the right place.
Not in the herbal, like, you know.
Yeah, not in wrong and funny places. Now, and then your healthcare provider will be able to identify what's causing that type of erectile dysfunction. If it is a psychological one, for example, like we said, they just need counseling, sexual counseling and therapy will do. If it is an organic cause of erectile dysfunction, for example, if it's hypertension, you just need to be on antihypertensive drugs and be on the correct antihypertensive drug, because some of those drugs too can cause erectile dysfunction. If it is uncontrolled diabetes, for example, like we said, control the blood sugar, use drugs regularly and monitor the blood sugar. If it is obesity, for example, weight loss alone would help. Yeah, because when you shed some weight, it reduces inflammatory markers. Yeah, it increases vascular blood flow. So weight loss alone would help.
And also
if if it's a drug that's possibly the cause of that erectile dysfunction, take away the drug. Because there's no need using a medication that causes damage, to a very sensitive damage at that. So take away those drugs. If it were malnutrition, for example, good diet will help. Good diet will help. If you can use antioxidant supplements too.
They can get from.
They are in fruits. They are in fruits. They are also as processed drugs in the pharmacies. All those ones too will help. If it is a hormonal problem ab initio, for example, somebody who has a high prolactin level, there are drugs, a low testosterone level too. There are drugs that can be used to correct those kind of anomalies.
Exactly. And in that case, he has to see, of course,
he has to see
the doctor.
Yeah.
Because going around looking for one or two things to do, or thinking of or believing superstitious stuff that will solve the problem, or no.
One thing that we did not even talk about as a cause is in sickle cell anemic patients. Yeah, the special condition, people who have sickle cell anemia, they usually have priapism, where they are sustained penile erection that is not triggered by any sexual thing. Yes. So once their male organ gets erect for over a long period of time, it causes damage to the blood vessels. Yeah. So if the person is a sickle cell anemic patient, for example,
avoid that.
Yeah.
Take lots of water, take the anticyclic drugs, and try to stay healthy. That will help.
It will help for those guys too. Then people, in those days, it's not common again. Bicycle riding for a long time is a cause of erectile dysfunction.
Horse riding too.
Yeah,
you have a
because sitting on a hard surface for a long time can compress both blood vessels and nerves, and then it causes damage to those vessels that supply the penis. So limiting those things that will trigger or worsen erectile dysfunction should be done. Then lifestyle modification.
Smoking, drinking should be avoided.
Of course, as a Christian, we think no Christian should smoke, and no Christian should drink alcohol and all that.
If it's an anatomical issue, like now, the person have the hypospadias and so surgeries could be done, micropenis and all.
Some of them will respond to surgeries. Yeah. For example, like if somebody who has an enlarged prostate as a cause of erectile dysfunction, is to go and take away the prostate, especially when you do the current ones that are done these days that will not cause damage to the nerves and all that.
Not invasive, not cutting and open.
So those ones can be done. Then for that couple who you have looked all round, you have tried psychological counseling, you have tried to remove the offending drug, You have tried to control diabetes, control hypertension. The guy is eating well, is no longer obese, and he's still having erectile dysfunction. That one would need help. Medical help will do. There are some drugs that are supposed to be prescription-only drugs, actually.
Like,
Sildenafil, Tadalafil, and all that. They can get them in pharmacies with prescription.
With doctor's prescription, because you know such drugs have been abused.
Of course, many people have abused. Even people who don't even have erectile dysfunction abuse them.
So they can have sustained erection and all. And such drugs have caused death for some people because it can cause hypertension.
It can. Some of them can cause arrhythmias.
And all. You've had some people dying in the act and all these things.
And they died in active service now. We've seen people die like that now after taking a whole lot of medication. Once you see anyone like that, just find out around them. They are probably hypertensive, and then they've taken a whole lot of drugs. And then high lipid level as a cause of erectile dysfunction.
Such one can go and take what?
Statins. No, but however, statins are also a cause of erectile dysfunction.
It's the paradox of life.
It's a paradox now. But people who have high lipid level, they will have the lipids clogging on the blood vessels, and blood flow through them is limited. So the erection is also limited. But they can, with the help of your healthcare practitioner, they can give them drugs that will limit, that will slow down the lipid levels, and then they can pick up their erection. It is important to note too that erectile dysfunction may just be the first sign of a cardiovascular disease. You know, many people do not go to the hospitals to seek medical care. It is common practice here. And because they do not, they will only go to a hospital when they have something they think is important. So I saw a couple who had erectile dysfunction, and while we were doing some investigation, the guy had hypercholesterolemia. Maybe
hypertension.
And then he had uncontrolled hypertension, and he had hypercholesterolemia. We just gave lipid lowering drugs, and the guy's erection became sustained to an extent. So those ones too are pointers and things that can be done for them. And then for people who persistently have this erectile dysfunction, even after you have applied all these mechanisms, you can do some investigations.
And you know, there's a surgical intervention, or should I call it surgical, when there's a tool that they push and help to pump and to help.
They are vacuum now. They are vacuum. They are vacuum that they can use. Some would even require surgeries to do. But how many people will be able to afford that in the first place?
That's in developing countries.
In this part of the world where people can barely feed.
Imagine.
And then you go to that extent of having a penile implant or having other intervention mechanisms done. But it suffices to say that erectile dysfunctions usually have cures. When you can identify the cause of the dysfunction. It is not something that people commit suicide for. It is not something that should break marriages. It is something that couples should discuss and seek help together.
Yes, I agree with you. And in such case, our advice is, when you have this issue, speak out. If you notice you have erectile issues, you notice that your penis is not erect during the intercourse or something, please speak out. Do not keep quiet. Do not go to the pharmacies to take any medication and all sorts. Do not go and prescribe something for yourself. Always speak out, seek the doctor's advice or seek the doctor's counsel.
All right, thank you, Dr. Momo. As we gradually wind down, it is important to note that many of these causes are treatable. That's one important thing. And then it is important to seek medical attention
Exactly.
as fast
As
as possible.
Sure.
Yeah. Thank you, viewers, for all our callers that called in. We appreciate you. Thank you for joining us
Thank you very
today.
much. Thank
And
you.
then we'll see you some other time. Have a great day and a great week ahead. Thank you.
Thank you. Bye-bye. Knowing that premarital sex is a sin, then how would you know if your future spouse has erectile dysfunction? That is, how do you know he is impotent? And if you're newly wedded, then realize that your spouse is impotent. What should you do? I will be giving medical and godly answers to these intriguing questions. Join me and my co-host, Dr. Kate, live on Health Talks, Fridays.
Hello, have you been searching for an appropriate platform to advertise and promote your product and services? Are you a minister of the gospel and you want your message to spread across the globe? Stop this search. We've got the coverage to give your voice and ministry the amplification you require. To get a rewarding and cost-effective solution to that business idea of yours, Celebration TV is here to take your dream to the climax. We provide the following services: voiceover production, documentary packages, video production of your event, video editing, script writing, affordable live broadcast of your events, and more. For more information, please contact us on +234 703 341 3637 or +234 816 234 8181. You can also reach us via our social media platform: Facebook Celebration TV, Instagram My Celebration TV, Twitter us at My Celebration TV, YouTube Celebration TV, and you can send us a mail at celebrationtelevision@gmail.com.